Good afternoon and welcome, everyone. My name is Rashi Romanoff, and I'm the Executive Vice President of the Elizabeth Dole Foundation. Thank you so much for joining us today for the latest installment of our Spotlight series. We launched the Spotlight series 2 years ago with our partners at the VA and Philips. The goal was to bring much needed content on high priority topic areas to veterans, caregivers, and their families during the height of the pandemic. Since then, tens of thousands of you have tuned in to learn more about topics like telehealth access, mindfulness, sleep solutions, and rural access to healthcare. Our last Spotlight series focused specifically on the issue of burn pits and toxic exposures. During that episode, we talked about how some veterans are more susceptible to certain illnesses, including cancer, as a result of exposure. I know that many of our viewers today, as well as the team at the Elizabeth Dole Foundation, are closely tracking activity over on the Hill related to the PACT Act, which seeks to expand healthcare access to more than 3.5 million veterans who were exposed to toxins while serving in the military post 9/11. Critically, it will also add 23 illnesses, including several cancers, to the list of eligible conditions for federal healthcare coverage. Today, we're going to dive in a little bit deeper into the area of cancer prevention with our esteemed panel. We know that every year there are nearly 50,000 new reported cancer cases among veterans. And we also know that the earlier cancer is diagnosed, the better chance of a positive outcome. Over the next hour, we will provide you with information around who is most at risk, what you can do to prevent cancer, and how to access screenings and other preventive resources at your local VA. I want to thank our partners at Philips for their steadfast support of our nation's military caregivers and for their continued partnership on our Spotlight series in 2022. I'd also like to thank the leaders at the VA for working with us so effectively to produce this valuable series. I'd now like to introduce Dr. Erica Scavella, Assistant Undersecretary for Health for Clinical Services and the Chief Medical Officer within the U.S. Department of Veterans Affairs. To save time, we're actually going to be putting her bio into the chat, so be sure to take a look. Dr. Scavella, welcome.
Thank you so much, and thank you to the Elizabeth Dole Foundation for having me and our team involved in this very important care. As you said, I serve as the Assistant Undersecretary for Health for Clinical Services, and I'm the Chief Medical Officer for the VA. Thank you for having us and for focusing on the topic of cancer prevention and cancer screening. And thank you to the veterans and caregivers who are joining us this afternoon. VA's mission is to honor America's veterans by providing exceptional, world-class healthcare that improves their health and well-being. We want to make sure that we include prevention and screening in every conversation. This discussion is important to me as I remember accompanying my grandfathers and uncles to their appointments at VA. They chose VA, and that is why I am here serving. This is really important to me and important to you. We need to make sure that we are advocates and are here to provide care for our loved ones. I bring my role up as a supportive granddaughter and niece because this topic is very important. It's personal to me, and I want to highlight the importance of caregivers as they accompany people to appointments, which can often be the bridge to ensuring that there is both screening and access to that screening, and the importance of cancer prevention. The role of the caregiver is very important in VA, and we understand that caregivers are critical partners in the healthcare team. For instance, caregivers often provide insight related to what may be happening with the veteran at the appointment, and can often, as I said, be that bridge to get them to an appointment for screening or for treatment. To underscore the importance of the role of caregivers, it would be an understatement. And in collaboration with the Elizabeth Dole Foundation, through the Campaign for Inclusive Care, we are training clinicians to embrace caregivers, encourage and empower caregivers as members of the team. Finally, I want to stress the importance of screening and speaking with your primary care physicians and providers about cancer screening. Whether you are a veteran or a caregiver, your primary care provider is a wealth of information when it comes to cancer prevention and cancer screening. We want to make sure that any military, environmental, or toxic exposures are developed, are discussed, and that you are able to discuss the ramifications of those potential exposures with your care team. The relationship that you have with your provider is key. When your provider understands your unique perspectives and experiences as a veteran, they can provide you with best world-class care. For veterans who have more questions about cancer screening for military toxic exposures, another resource is going to be your VA Environmental Health Coordinator, and we can find more information at publichealth.va.gov/exposures. We are here to support you, and we're here to provide the best care. Now it's my pleasure to introduce VA's Executive Director of Preventive Medicine, Dr. Jane Kim, who will be speaking about cancer screening and prevention.
Thank you, Dr. Scavella, and thanks to all of you for the invitation to speak to you about cancer prevention and screening. I will be talking today about cancer screening and prevention for veterans, but I do see that the role of the caregiver, as Dr. Scavella said, is critical. You are partners with your veteran in healthcare, and the more you know, the more you can help your veterans. So I'm just thrilled to be here with you today to talk to you, and I'm going to give you an overview of the topics I'm going to cover. First, I'll give you an overview of the most common cancer diagnoses in veterans, talk some about healthy lifestyle behaviors that are important to reducing cancer risk. We'll go over some recommended cancer preventive services for veterans. And finally, I'll leave you with some resources to help veterans prevent cancer and that can be helpful to veterans and their caregivers as well. Next slide. So Dr. Scavella already reviewed the Veterans Health Administration, or VHA, mission. Indeed, we are here to improve our veterans' health and well-being. I did want to highlight a few key elements of the VHA vision that are in bold here, that we strive to provide exemplary services that are both patient-centered, evidence-based, and emphasize prevention and population health. As you can see here, prevention and population health are critical elements of how we care for our veterans. Next slide. So to focus in on cancer prevention, when we think of cancer prevention, we often think of screening tests such as mammograms or colonoscopies, but it's important to realize that healthy behaviors are the foundation for reducing cancer risk. We often think that these behaviors help to prevent heart disease and stroke, but actually they also prevent cancer. Getting regular physical activity, striving for a healthy weight, being tobacco-free, limiting alcohol, and other healthy behaviors are powerful tools for reducing cancer risk. Hand in hand with healthy behaviors are screening tests and immunizations. These have been proven from scientific evidence to save lives. Detecting cancer or pre-cancer at early stages, when it is more easily treatable than at later stages, can help to prevent cancer death. Next slide. So to give you an overview of the most common cancers diagnosed among veterans, these statistics are from an analysis of veterans who use VA healthcare from 2010. The most common cancers diagnosed in female veterans were number 1, breast cancer, followed by respiratory cancer such as lung cancer, gastrointestinal cancer, and then gynecological cancer. For male veterans, the most common cancers were prostate cancer, followed by lung and bronchial cancer, colon and rectal cancer, and skin melanoma and kidney cancer tied for 4th. Next slide. So I wanted to expand a bit more on the strong relationship between health behaviors and their contributions to causes of death, including deaths from cancer. This slide shows US data from the Global Burden of Disease Study. Cancer deaths are in light blue. If you look at the bar graph on the right, the red arrow points out that light blue color. On the left side, you see that 4 health behaviors and high body mass index represent 5 of the top 10 causes of death in the US, and together are responsible for over 1.5 million deaths each year, including deaths from cancer. So we can see here the strong relationship between health behaviors and causes of death, including death from cancers. And to take that a step further, specific risk factors, including health behaviors, warrant increased attention. Next slide. So given this, VA recognizes that a healthy lifestyle is the foundation for preventing and reducing risk of cancer and other health conditions among veterans. This slide shows VA's healthy living core areas. And to walk you through them from the top and going around clockwise, they are the Move Weight Management Program for veterans, Clinical Preventive Services Guidance, the Infection Don't Pass It On campaign, the Veterans Health Education and Information Program, and the Health Promotion and Disease Prevention Program. I'll talk more about these programs later in the presentation, but each one of them offers policies, guidance, resources, and training to help VA clinicians, veterans, and caregivers promote health and well-being among veterans. Next slide. So to support these healthy living programs, this slide shows the 10 healthy living messages that help clinicians, veterans, and caregivers address health behaviors that matter. You can see here some of the key behaviors we've already talked about, plus additional ones such as the importance of sleep and managing stress. Next slide. So next topic, I wanted to turn the page and look at these recommended preventive services, such as cancer screening tests, immunizations, and preventive medications such as aspirin. These recommendations are based on high quality scientific evidence and the recommendations from the U.S. Preventive Services Task Force and the CDC. Shown here are just thumbnails of charts of these recommended services for men and women. I will go into more detail the services recommended for cancer prevention on the coming slides. Next slide. So to start off with cancer screening and prevention recommendations for women veterans. Before I dive into these, I wanted to note that these recommendations are for women at average risk for cancer, women who have a family history of cancer, personal history of cancer, or other risk factors should discuss their individual situation with their healthcare provider. The first service here is colorectal cancer screening, recommended for women ages 45 to 75. There are a number of different options for screening, including stool cards and colonoscopy. Next is lung cancer screening, recommended for women 50 to 80 years old who currently smoke and have met certain thresholds for smoking or have quit within the last 15 years. For women who currently smoke, tobacco cessation is highly recommended as it has a great impact on decreasing the risk for lung cancer, other types of cancer, and other diseases. Breast cancer screening with mammography is recommended for women 45 years and older. Cervical cancer screening with pap smear and human papillomavirus or HPV testing is recommended for women who are 21 to 65. And HPV immunization is recommended for women 18 to 45 and is a 3-dose vaccine series. Next slide. So this is a larger screenshot of the recommendations for women. Ages across the top, so you can find your age or your veteran's age there, and the recommended services are listed on the left side. Green means go, or that the service is recommended. Red means that the service is not recommended, and yellow means that the service is recommended for some women. This full chart is available publicly on VA's prevention website, which is hyperlinked for your reference, and I hope that will also be in the chat as well. Next slide. So to turn to cancer screening and prevention for men, the recommendations for colorectal and lung cancer screening, tobacco cessation, and HPV immunization are the same for women and men. Prostate cancer screening can be done for men ages 55 to 69, but is based on an individual decision by men, as there is benefit to some men of early detection and treatment, but also potential harms from treatment that men should consider. Next slide. And again, this is a screenshot of VA's preventive service recommendation chart for men available on VA's prevention website. Next slide. So next topic, we'll cover cancer prevention resources for veterans. Although the rate of veterans who smoke has been falling in recent years, which is fantastic news, we would love to see many more veterans become former tobacco users. We know that quitting tobacco can be challenging, and so VA has created many great resources for veterans, including the VHA National Quit Line, or 1-855-QUIT-VET, Smoke-Free Vet text messaging, There's a Stay Quit Coach mobile app. There's an app for everything. And if you are a veteran or your family member is a veteran enrolled in VA healthcare, there are medications and behavioral interventions available through VA healthcare providers. Next slide. In terms of weight management, for veterans who use VA healthcare, there is a nationwide weight management program called MOVE, available at all VHA facilities and clinics. MOVE is an evidence-based, comprehensive lifestyle intervention that combines physical activity, dietary, and behavioral elements. This was established in 2006, and since then, MOVE has reached over 900,000 veterans and has helped a substantial proportion of those achieve clinically significant weight loss. In keeping with the times, MOVE is available in a number of modalities and formats, including in-person, phone, and video visits. And for those who like an app, there is a MOVE Coach mobile app. Next slide. So a great resource to learn more about cancer screening and prevention and other health conditions is the Veterans Health Library, also abbreviated VHL, which is available on a website accessible by the general public. The VHL contains a wealth of health information tailored for veterans, including health and medication information sheets in English and Spanish, and a number of other resources in various formats that you can see here. Next slide. I pulled out two examples of cancer screening information on the VHL. The left is on breast cancer screening and mammography, and the right is on lung cancer screening. Next slide. I wanted to touch upon veteran exposures and cancer, which Dr. Scavella mentioned in her opening remarks. This is a topic that we get about cancer screening and the relationship of cancer screening to veteran exposures. Certain illnesses, including some cancers, have been linked to specific exposures. If you or your veteran has questions about these exposures, we recommend discussing individual risks and cancer screenings with your healthcare provider. There is a wealth of information on specific exposures, presumptive conditions, and eligibility for benefits available at the hyperlink on this slide, which is on the va.gov website. Next slide. Another question we receive is whether veterans have a copay for preventive services. For veterans who receive VA healthcare, there is no copayment for outpatient visits for preventive services, such as screenings and immunizations. Next slide. So I wanted to end today with a few suggestions on what you can do next. There has been a ton of information I've thrown at you, so what can you do? The first suggestion I have is to talk with your primary care provider about cancer prevention. They know you best and can help you or your veteran make a plan for what to do next. It could be, as it says here, setting a healthy lifestyle goal. They can tailor that to what you think will work for you and what they think would be most beneficial for you. I have here that small changes add up over time because I know making health changes is hard. I'm trying to make a health change right now myself, and I myself have set a small goal. And I think the value of setting a small goal is that it is doable. And once you start with that and stick with it, these small changes add up over time. So I really encourage you, if you're thinking of doing something, set a goal that's achievable, even if it seems too small, and go for it. Third, I wanted to leave you with information on applying for VA healthcare. If you or your veteran has not yet applied and is interested in applying, there is information on the va.gov website to help you do that. Next slide. And so I love to end with a story. And this story is of a veteran, Darlene Weigland, who is featured in one of hundreds of MOVE success stories. She says it best in her quote, "You are not alone. Hearing other people's stories and getting support keeps you honest and motivated." If you read this full story, you would see that she lost a tremendous amount of weight by working really hard and getting support from her veteran community. I cannot believe that she has even run a half marathon, but It is just incredible and commendable. So I did want to leave you with this as inspiration for you and your veteran, that making these changes can lead to great benefits. And Darlene is encouraging all of us to go for it. Take those steps today to um, uh, initiate healthy behaviors and healthy lifestyle changes, or get those cancer screenings that will put us on the road to a full lifestyle. So I think that's all I have. Thank you so much. I appreciate the time.
Thanks so much, Dr. Kim. I love ending on one of those stories. Hearing individual stories of triumph and people reaching their goals is so inspiring. Thank you also for such an insightful presentation. We are really excited to start our robust Q&A. One of the things we do with our Spotlight Series episodes is we really try to leave as much time as possible for Q&A directly from the audience. And so to all of those that are tuning in live, please submit your questions in the chat or using the Q&A function. We are compiling them on the back end. I know we got a bunch of questions from registration, so luckily we have a little bit of a head start, but if there's anything specific that you want to ask our panelists, please go ahead and submit them via the chat. Before we start Q&A, I do want to introduce two additional panelists that we have joining us today that we're really excited about. First up is Dr. Ella Kazerouni, a professor of radiology and internal medicine at the University of Michigan. She's also the chair of the National Lung Cancer Roundtable with the American Cancer Society. Dr. Kazerouni is an expert in early detection and screening and is dedicated to improving access to modern diagnostics and treatments. We're so excited to have you. We are also joined by Alton Hedden, a product manager within the Oncology, Informatics, and Genomics Division at Philips. A retired U.S. Navy hospital corpsman, Alton is experienced in advanced imaging, lung cancer screening, and incidental pulmonary nodule management. Dr. Kazerouni and Alton, thank you so much for joining us. So diving into Q&A, Dr. Kim, one question I have for you, following up on your excellent presentation, what is it that you would say to someone who, they're watching your slide presentation and they recognize, I'm at a heightened risk, or the veteran that I care for falls into one of these scary red categories, or perhaps cancer runs in their family, or they used to smoke. What should be their next step? What do they do next as soon as they sign off this webinar?
Yeah, that is an excellent question. I actually am so glad you asked that, because I was at a National Lung Cancer Roundtable event with Dr. Kazerouni recently, where someone shared they actually saw a presentation like this. It was actually an advertisement that made them think, am I eligible for lung cancer screening? So they went to their primary care provider and asked about it and got screened. I really highly encourage you, if you think you might fall into one of these categories, you're wondering, if I got a pap smear in time, am I overdue for mammograms? Talk to your healthcare provider. Talk to your primary care provider. They know your history. They know what you've gotten, what you're due for, based on your smoking history or other risk factors. I just recommend speaking with your provider. Send them an email message, give them a call at your next appointment. But if you can't wait, give them a call today. That's what I would recommend.
Terrific. Dr. Kazerouni, a question for you. We know that some patients or veterans might be nervous. There's a lot of anxiety around cancer screening, whether it's the procedure itself. Sometimes it might be painful, or you're just nervous about maybe getting the results. What would you say that caregivers and family members can do to encourage their loved ones to get screened?
Yeah, so specifically regarding lung cancer screening, it's a great question. It's relatively new, and of all the screening tests that we do to detect cancer early, things like screening mammography and screening for colon cancer have been around a lot longer, and people are more likely to know somebody who's undergone those screening tests and can ask, what's it like, and how did you go through the experience? Lung cancer screening is actually a pretty straightforward test. It's done on a CT scanner. You really don't even have to change your clothes, as long as you don't have any, big pieces of metal jewelry or something on. And you lay on the CT scanner table, you take in a deep breath and hold it, and we take the pictures. Modern CT scanners are pretty quick. It only takes a few seconds to actually take the pictures. And then a radiologist will look at them to see if there's something suspicious there in your lungs. The interesting thing about lung cancer screening is we can find things that could be lung cancer, but we can also find some other things that your primary care physician can help manage. So we can see calcium in your coronary arteries, which might be an indicator of cardiac disease. And so your family medicine physician, your primary care physician can look at your cardiovascular risk and help you manage that as well. Or may see evidence of emphysema in the lungs or lung disease that might be caused by cigarette smoking. And similarly, your physician can help manage that. So we can see some other things that can kind of help you as a health check, if you will, with lung cancer screening being the primary motivator. And then of people who do have an abnormality on our lung cancer screening CT, the most common test that we do to follow that up is another CT scan in about 3 to 6 months to check on those small findings and make sure that they're not growing, so that we can continue down your annual lung cancer screening journey. For the very small percent that have an abnormality that requires something more invasive, they'll usually see a specialist like a pulmonary medicine physician who might recommend a biopsy or a PET scan. And ultimately, in patients that are very high risk based on the findings, may need to undergo treatment for what proves to be lung cancer. But it's very painless. Lay on the table, get a CT scan, and get your results.
Great. Elton, this might be a question for you. I'm sure Dr. Kim also has thoughts on it. What do you suggest to patients or caregivers, if they're encountering something where maybe their primary care provider is maybe disregarding their request for a cancer screening, or they're asking about it and maybe the PCP is saying like, oh, I'm not sure. How should patients and caregivers really navigate that when you're feeling like you might have some kind of disagreement with the PCP?
Yeah, absolutely. It's a great question. One of the best way to handle this is, of course, to manage your own care, and really kind of let your PCP know that you are worried about this and you would like to get the care or get the screening completed. But the other one is, going to a pulmonologist or the pulmonary clinic and self-referral, or seeking another doctor.
Dr. Kim, anything you would add?
I agree. I mean, it sounds like a conversation was had, but I think continuing that conversation is important. I found with patients, there's often something driving that request, and a lot of times it's fear. Fear of missing something, fear of getting sick, fear of missing time with their loved one if they don't get the cancer diagnosed. So I think it's just important to get some time to just explore that, because that is really important. Getting a cancer screening is one thing, but it doesn't necessarily take away the fear. And I think having that fear is worth discussing that and talking through that and talking through your individual risk with your provider a bit more.
Yeah. I know that the VA is still collecting data on things around toxic exposures, and every day it feels like we're learning more and more around toxic exposures. But Dr. Kim, what can you share in regards to maybe some of the trends that we're seeing around those that might have been exposed to burn pits and developing cancer?
Yeah, that's a great question. I know that there was a whole webinar, as you mentioned, on this topic previously. I think we are still learning the answers to that question. A key way that we can find out the answers is to register veterans in the registries that are going on around specific exposures. What that means is that, and it's voluntary, a veteran who was exposed, say, to burn pits can choose to enroll in the burn pit registry, where they get a comprehensive history, sometimes also a physical exam, and their information is recorded to see if there are trends, if there are patterns. The best way to know if there is a link is to study it and find out if that is actually there. So the registry is voluntary, but it is a key way that we can find out the answers to that question.
And regarding the registry, is that something that, as VA learns more, as the research gets better, if I'm a veteran and I'm signed up for the registry, will VA reach out to me to say, hey, according to new research, you should come in and get screened for that? Is that sort of how that two-way communication works with the registry itself?
Yeah, I am not the expert on how that works. I just know that in VA, as Dr. Scavella mentioned, We do have an environmental health clinician at every VA facility or major hospital who coordinates those exams for veterans, as well as some of the veteran-specific care and recommendations for that care. So I know in VA we have an ecosystem in our health system when there are changes or new recommendations for veterans based on risk, to get that information out through our healthcare network for our clinicians to have at the front lines. In terms of other communications, I'd have to take that back for an answer. I know there is the website that Dr. Scavella mentioned, which is updated with new information as the science advances.
Thank you so much. Dr. Kazaruni, this one might be for you given your affiliation with the American Cancer Society, though honestly on these questions, I welcome all three of you to chime in. I think you all have lots of great experience. What resources and support do you recommend for caregivers of veterans with cancer? Are there online communities? Are there group supports? What kinds of things can a caregiver or family member sort of look to if they're looking for more support?
I think I'll probably let Dr. Kim weigh in with respect to the VA for veterans. There are certainly resources at the American Cancer Society, lots of patient-facing materials to help them with their cancer journey. And the Go-To Foundation for Lung Cancer is a major patient advocacy organization. And on their website, they have communities, they have materials that can help patients understand their cancer diagnosis and the questions that they should ask.
Absolutely, and I'll add on a few programs and resources that are veteran specific to consider. One is the Fisher House program, which may have been discussed on a call in the past, but it's just inspiring to me. It is a set of homes for families, caregivers, and veterans who are undergoing care and treatment at the facilities that are walkable homes from the home to the facility. It's a great resource that is free of charge for those who qualify, where there's a Fisher home. I encourage people to look into that availability. The second program, which I think has also been discussed in another call, I'm sure, but I'll bring it back here, is the Program of Comprehensive Assistance for Family Caregivers, which is available to caregivers of some veterans who qualify based on their disabilities and their period of service. So again, I know that there are links to these resources online. I looked them up and found them fairly easily, but those are the specific resources that I'd suggest for families and caregivers.
Great, and I'll also do a plug for the Elizabeth Dole Foundation and our online peer support community. You can register as a military or veteran caregiver at www.hiddenheroes.org. We also have our HHCC Hidden Heroes Caregiver Community on Facebook. I know one of the things that our team really loves is just seeing caregivers sort of ask each other questions and ask each other for advice and sort of how they're dealing with everything from care coordination to diagnosis to symptom management. So really recommend anyone who's listening, reach out, register with us and get connected to some resources. Dr. Kim, one question we got in the chat that was a little bit more specific was, can you explain monoclonal gammopathy and any connection with Agent Orange exposure? And then specifically, is MGUS, monoclonal gammopathy of unknown significance, a form of cancer?
Wow, that's a great question. So I'd have to look up if there is a linkage between, we say MGUS, because it's a mouthful, as you just said, and Agent Orange exposure. I know that MGUS is considered, from what I remember, and I'm not an oncologist, but it's kind of a potentially precancerous condition that is usually watched by an oncologist or cancer doctor closely for any possible progression to cancer. Whether it's been linked to Agent Orange, I'm not sure, but I can look that up. I know that there were a number of new conditions added under presumptives recently, so that may have been one of them. I'll take that back for the team to answer.
Terrific. Maybe great. Our team can follow up with the person who submitted the question and make sure you get that, and we can follow up afterwards as well. Just going through the questions here. Dr. Kim, what percentage of women veterans are receiving breast cancer and gynecological cancer screening in community hospitals. I think that was one of the questions that came in. If you can comment maybe on the trends around women veterans seeking cancer prevention within the VA versus within the community.
Yeah, so for mammography or breast cancer screening, we do have the numbers for that. And it turns out that the vast majority of our women veterans get care in the community, which is what VA pays for through a community non-VA provider. 98% of our women veterans get their mammograms in the community, which is quite a few. We do have mammography centers at a lot of our major medical centers, but there, I think, are a lot of rural areas or areas where there is mammography expertise and imaging technology outside of VA, which VA partners with to get women to mammograms. So that is inclusive of all types of mammograms, including screening and also diagnostic and surveillance mammograms. But I would say probably a large number of those are screening mammograms. For gynecologic services or cancer screenings, such as cervical cancer, I have the percentage of the overall consults for community care or non-VA care for that. And it turns out 25% of our women get their gynecological care outside of VA, but 75% get it in-house with one of our VA gynecologists. This, again, is inclusive of all gynecological care and obstetric care. So as you can see, the percentage that are screening is probably lower, but you get a sense for the balance mix of services done outside of VA and inside of VA for both mammograms and gynecology.
Great. Dr. Kazerouni, if one of the questions we got, if something unknown is found during a cancer screening, how is that typically handled and how is that monitored?
Yep, so it depends on the specific screening test, but for example, both with breast cancer screening and lung cancer screening, where we're doing imaging to find abnormalities, there are some abnormalities that we're going to find that are more concerning than others, and those are going to go down a conversation with the patient about how likely it is that the finding might be cancer, and next steps are more likely to include something like a biopsy. But for many of the findings, we're going to do a follow-up test that may look somewhat similar to the screening test itself to follow up on those findings and make sure that they're not growing. We look at lack of growth of a spot in the breast or calcification of the breast or a spot or nodule in the lungs as evidence that it's not acting in an aggressive manner, and so that we can keep checking on that with follow-up testing.
Terrific. One question we got, and this might be for you while I have you, Dr. Kazerouni. One person noted, I'm noticing that women are getting breast cancer earlier and earlier. But you're hearing more about women 28, 29, still in their 20s, sort of developing breast cancer. What are your recommendations for young women that are concerned about that?
So I really recommend that they talk to their primary care physician about their individual risk. There are some people that are younger and have risk factors, particularly related to strong family histories, that they may undergo screening at an earlier age than if they did not have those family associated risk factors. So it's a really important conversation with their primary care physician to understand their risk.
Another question we received, if my family has a history of cancer, but they're all smokers, I am not a smoker. Do I still have to be concerned about hereditary cancer?
Yeah, that's a question that we commonly get because it's hard to separate out the exposure of cigarette smoking and any underlying genetic abnormality. In most cases, it is the cigarette smoking that is the primary driver of lung cancer risk. So in individuals who have not had a history of cigarette smoking themselves, their risk for lung cancer is lower, even in a family history of individuals who may have had lung cancer and been cigarette smokers. So the current recommendations for lung cancer screening, for example, do not recommend lung cancer screening in individuals who have never smoked.
I've read that, sorry, this was a question we got. I'm just reading now directly from it. I've read that blood tests are a good option for early cancer screening. Why aren't these done more regularly for medium to high risk veterans?
So I think I'm just going to take a guess here and maybe the person can comment back. There is a lot of interest now on genetic markers for some cancers to be of potential use as screening tools. those have not yet come into kind of the common recommendations for cancer screening, such as low-dose CAT scan for lung cancer screening or for breast cancer screening, but there is a lot of research going on to see if any of these blood tests can be used as screening tests. So not any that I know of, but I know that there is a ton of active research, including with the Cancer Moonshot initiative, to explore whether we can find a test that works, blood-based test that works for screening as well.
One question we got from a cancer survivor, they said, I'm a cancer survivor. What tests should I be getting regularly? How do I figure out, which screenings I should be participating in?
I think it's very so much as some of what you've heard already today, which is that you should discuss your risk for cancer with your primary care physician. Whether you have never had cancer or you've had a cancer of a different type, or you have other medical illnesses that might prevent you from getting the benefits of screening, it's a really important discussion with your primary care physician.
Definitely a theme from today. Talk to your doctor, talk to your primary care physician. It's never too early to start talking about cancer screenings and cancer prevention. I love that theme. Dr. Kim, I know that you mentioned this in your slides, but I'm going to ask it again just to underscore the excellent point. How much does it cost a veteran to get screened for cancer within the VA?
Nothing. There's no copay. So that is something that is just a terrific service for our veterans in the VA healthcare system, is that they do not need to worry about that cost as an issue. If they're looking at getting a mammogram, there's no cost for that, for example. Same thing for the stool cards for colon cancer screening. So it's worth talking with your VA physician to see what you do for. As you can see, there are options sometimes for some cancer screenings. I know with the pandemic, many patients didn't want to come in the facility, for example, and so we sent them stool cards. You can do that at home, mail it back, and that is a valid and evidence-based form of colon cancer screening. So a number of options out there. I just encourage people again to talk to their healthcare provider.
Great. And Dr. Kim, while I have you, we got a couple more questions around burn pits and cancer diagnosis. So I think just even if you might have said this, I might ask it again. Questions coming in: should I be screened more often if I was exposed to burn pits? What other screenings should veterans have that might already be enrolled in the burn pit registry?
Right. So again, the answer is to talk to your physician about what may be recommended for you. I think in addition to burn pits, you may have other risk factors or other exposures. You might have family history. So burn pits, I'd say, is one part of the puzzle here. And it's important to kind of discuss your whole health and all aspects of it to see what screenings or preventive measures might be recommended for you. It might be that, like we talked about, physical activity might really help you quite a bit. There is just such strong evidence about physical activity, for example, being as effective as medications, as many medications in reducing risk. So I'm just kind of trying to give an example of the importance of kind of having that full conversation about your individual case with your physician to see what steps you should take.
One question we received: I've recently been diagnosed with cancer and am researching treatments. What can I do to preserve my fertility? What kinds of questions should I be asking my PCP or my primary care provider?
Yeah, I think you should just ask that question because I think that I'm assuming this is a woman who is wanting to have children even after treatment. That is, I think, a common situation for those women of childbearing age. And please, if you haven't already, have that conversation with your oncologist.
Great. I'm looking through our submitted questions. I think we've asked a lot of them. Oh, I have a couple more here. My husband is getting tested next week for cancer of the cornea, and he is 100% disabled. They're mentioning that they live pretty far away. They have some travel issues to get to their local VA. The caregiver is asking, is community care a possibility for him rather than long travel? Dr. Kim, what advice do you have?
Yeah, again, if I am guessing that this veteran is enrolled in VA healthcare and has a primary care provider, talk with your provider about those options. We fully recognize that, especially in rural areas, but also urban areas, travel is a big factor. There is assistance for some veterans in paying for their travel. That depends on their individual situation. So if they need to get to care with their own personal vehicle, there may be assistance for that. But again, there are options in the community. If access is an issue and you are too frail to travel, for example, there is the community care program, which I mentioned before, that a lot of our veterans get mammograms with, that could be available for you if your health situation kind of meets those criteria. So again, talk with your local VA provider to see what options are available.
Great. I have one question left for each of you, which I'm going to give you a chance to think about while I do a couple remarks here, which is around, what's one sort of last thing you'd like to leave everybody with today on this topic. So I'll give you guys a second to think about that. I do want to thank everyone for joining us today for this really important discussion. For our viewers, if you have different ideas around topic areas that you'd like to see a future one of these episodes dedicated to, please reach out to the Elizabeth Dole Foundation. Let us know. We really want this content to be driven by you. I think almost all of our topics that we've had have come either from Q&A or someone emailing us after. So if you're encountering anything or you have any questions, please feel free to reach out and send us your ideas, and we'll do our best to accommodate. All right, so I'm coming back around for everyone's final wisdom and sort of final parting thoughts. Elton from Phillips, I'm going to start with you. What would you like to leave folks with today?
I think the biggest thing is there's always barriers in your healthcare. I don't have enough time. I have to work. I have to do this. I have to do that. Don't wait. Make sure you get your exams, get your screening studies, go and talk to your doctors, and take ownership of your care, because the longer you wait, the more complicated things can get if found. So that's what I would recommend.
Terrific. Dr. Cazzaruni.
Following up on what Elton said, I would definitely echo the sentiment of take control of your healthcare and engage in preventative services that can keep you healthier and help you live longer. For lung cancer screening specifically, whether it's for you, a friend, a relative, somebody you know, if you're 50 to 80 years of age and you may have smoked cigarettes in the past, please talk to your primary care physician to find out if lung cancer screening is right for you.
All right, Dr. Kim from the VA, final thoughts.
Yeah, I think in addition to all that's been said, I'd say think of one thing that you can do or encourage your veteran to do to start today, to pretty much take charge of your own health. Like I said, we've talked a lot about the health screenings and cancer screenings you can get through the healthcare system, but there are a ton of things you can do on your own. You can read up on the Veterans Health Library if you have questions about cancer. That might be a first goal you have. You could have a goal of walking for 10 minutes a day. That's actually my health goal. And you might say that's too small, but we all got to start somewhere. So I just encourage you to think of one thing you could do. I've been thinking about it for a while. Set a time, set a goal for yourself, tell somebody, hold yourself accountable to them. Just get started.
It's great advice. Dr. Kim, Dr. Cazzaruni, Elton, I want to thank you all so much for taking time out of your day to chat with us and to chat with, most importantly, our amazing community around cancer prevention. Huge thanks around the valuable insight, the passion, and the expertise you all brought to this episode. For all of the caregivers who are tuning in, please be sure to sign up for our Hidden Heroes caregiver community if you haven't already done so. To become a part of our network, please visit www.hiddenheroes.org/join. And we look forward to seeing you for future events. Thanks so much, everyone. Have a wonderful afternoon.